Hi,
Hi,
Fatma. Lovely to have you.
thank you for having me. I'm so sorry for the delay. It was a bit of a technical issue.
No worries at all. I think we'll get started.
Yeah.
Welcome, everyone. Thank you so much for joining us today. We're really excited to have this conversation. As many of you will know, this is Diabetes Awareness Month. There was Diabetes Awareness Day on the 14th. And we thought it would be really important to have this discussion and have this webinar available for all of you. So I'm Zuleika. I'm hosting this webinar on behalf of Mint Tea, and it's on the topic of navigating diabetes burnout. As all of you will know, Minty is an online mental health platform. We provide therapy services and self-therapy tools, and one of our biggest aims is making your mental health journey easy so you can find tools that are accessible to you, whether that is connecting with a therapist or just accessing some kind of tool on anxiety or reading up on OCD. So whatever it may be, we aim to make that process easy for you. Today, we're looking into navigating diabetes burnout, and diabetes impacts so many people worldwide, millions worldwide. And beyond those physical challenges, there are also significant emotional toll that this can take on people. And a key aspect of that is burnout. And from a statistical point of view, around 44% of adults with type 1 diabetes actually report experiencing burnout. So it's a really, really high percentage. And that burnout can look like, it can look like complete physical exhaustion. It can look like not wanting to take care of themselves anymore, not feeling motivated to take care of themselves. And a lot of the times when we talk about burnout, we think of it from a corporate standpoint, but burnout does show up in chronic health. And I gave the statistic for type 1, but in type 2, it's almost identical as well. You have it figures at 43%. So 43% of adults with type 2 diabetes report experiencing burnout at some point. Beyond that, we've also got caretaker burnout. So for people who are struggling with diabetes, there is often someone who is taking care of them, and they play a significant role in caregiving and taking care of the person, in monitoring with medication, monitoring with insulin, and that support, giving that support can also have a strong emotional toll. It might be rewarding, it might be necessary, but when you're balancing that kind of support with with a heavy workload or with family, with other responsibilities that you might have, feeling emotional strain is quite common. So it's really important that we acknowledge these strains and that we have the space to accept them and some solutions for them too, which is why I'm really pleased to have Pamela Durant from Diapoint and Fatma Suleiman on behalf of Minty here with us today. So Pam is a highly accomplished healthcare professional. She's a certified diabetes wellness and lifestyle medicine coach, specializes in women's health, and is particularly passionate about empowering people who've been touched by diabetes. She's also the founder of Diapoint, which is a company dedicated to education, advocacy, and tailored support for people who are struggling with diabetes. From Minty and on behalf of Minty, we have Fatma Suleiman, who is a CDA licensed psychologist and cognitive behavioral psychotherapist. She's got great expertise in treating OCD, depression, anxiety, trauma, and is just generally extremely passionate about mental well-being and giving people the tools and resources to empower them. So I'm really pleased to have both of you here today. I'm going to stop talking and let you both get started, and I'll pass over to you, Pam, to give us a little bit of insight into, what you've encountered, what diabetes burnout actually looks like.
Thank you so much. And thanks everyone for joining. It's great to be here. I want to begin by saying first, I do not live with diabetes. So when I speak about my own personal experiences, my lived experiences as a caretaker of a child with type 1 diabetes who was diagnosed at 18 months old. And I imagine that some of the symptoms and things that I experience in my own burnout and stress and anxiety and whatever else that condition brings with it might be similar to somebody that's living with diabetes, but if there is someone in the webinar listening, if you have any questions, if you live with diabetes and you have questions at the end, please don't hesitate to ask. So what does diabetes burnout look like? I think it looks different probably for every single person. The manner in which people are diagnosed, the timing in which they're diagnosed, the reasons they're diagnosed, and then how they're managing their diabetes within their lifestyle, whether it's type 1, type 2, gestational, LADA, MODY, or some other form of diabetes. There are certain common factors that might cause burnout at various times. And I think one of the biggest one is just that diabetes does not sleep. It's a chronic condition. So even if you're on this call and you have a chronic condition, you might be familiar with some of those feelings as well. There is no break. When my son was diagnosed, the first pediatric endocrinologist that we saw, one of the second thing he said to me after he said, let him eat, let him be a kid. Of course, he didn't mean eat junk food. Nobody should be eating junk food. That's often what people think of with diabetes. But he's like, just, carry on as normal. But the second thing he told me was that this condition is going to nag you. It's going to get on your nerves and you're going to really get sick and tired of it and you're going to hate it. And I thought that's a very strange thing for a medical doctor to say to a patient or the mother of a patient. But that was some of the best advice still to this day that any doctor has ever given me outside of the clinical things. It doesn't stop. And even now that my son is almost 17, I mean, I can tell you the last 2 nights I've been awake for many hours, on the hour, checking things, doing things, still working in the background just to make sure his, life continues. Of course, he's taken over a lot of the responsibility of things over the years, but that doesn't mean that your caretaking necessarily just cuts off one day and it's easy. It's not. There's a lot of anxiety around it, sending your child to school for someone else to support them in their care when they're not really trained or experienced in their care, can be difficult. Psychosocial situations are really challenging. And that in itself is almost, I would say, more challenging than just understanding the basics of insulin dosing and carb counting. So diabetes touches on every single aspect of your life, not just nutrition and what you're eating in your lifestyle, which is why psychological support is so important. And it's good to reach out for support, maybe even before you're feeling like really burnout. What is diabetes burnout? The people that I know that have diabetes that have faced burnout, they get to the point where they just don't want to deal with it anymore. They're tired of checking their blood sugar. They're tired of counting every single carbohydrate they eat. They're exhausted. It's been proven on average that a person with diabetes makes like 50 or more decisions than the average person on a daily basis. And we know people already face burnout without a chronic condition in their life, and it's just something else added on top of it. So the weight of it's really heavy. So my definition is rather long, and I don't have one specific clean definition for you because there is no easy way to define it. It can affect people at various times and different times in their diabetes journey. And you may experience burnout even more than once. It's not like, oh, okay, I did this once and I'm done. No, things can trigger a burnout. I mean, for myself, I'll be super transparent. My son faced a little bit of discrimination at school once, for an event. And that really, really was very upsetting, especially when you're working so hard in the background to make sure everything runs smoothly for them. And that did send me down a little bit of a spiral of a burnout. So that was my experience, but another mother that may not have triggered her to have a similar experience. It could be something completely different.
There's an idea as well, though, of once you've experienced it, you're more susceptible to experiencing it again. Thank you, Pam, for sharing, for sharing all of that and for being so vulnerable, with your own experiences. Fatma, how have you seen both diabetes burnout, caregiver burnout, and generally people managing mental any form of chronic condition. How has that shown up for you in your practice?
I think the most important thing when I work with clients that have chronic long-term conditions are getting to a place of acceptance, right? A lot of people that might come through the door, they've freshly got a diagnosis of diabetes and they're in a state of denial, right? They don't want to accept it. They don't want to kind of even want to make those changes in their life that they need to change. And it's about mainly working on psychoeducation, getting them to understand the impact, the mental impact that this will have on them, but also accepting that this is something that they're going to have to deal with. And how do we make those changes? What is within our control? What can we kind of work with? And it can kind of show up in frustration. It can show up in irritability. It can also show up in anger, right? Why me? Why did this happen to me? But it can also show up in shame. You know, they feel shameful to tell their loved ones or people close to them that this is what they're dealing with, or even society with the stigmatization of long-term health conditions. It can really impact them. So it's about working around the guilt, the shame, the frustration, the anger, the multitude of emotions that come with having this diagnosis and living with it. And like I said before, looking at what is within our control, what can we actually uh, do about it, but also how can we still live our lives to the fullest alongside this condition?
Yeah, so I'm hearing a lot of acceptance helps. But how can people get to that point of acceptance?
I think in the beginning they just need to be able to process what information was given to them, right? And that can come from,
Sorry to interrupt you, but could you speak just a little bit louder because your voice is coming through a little deep.
oh, sorry, can you hear me now?
It
Yeah,
might be a little better, yeah.
okay. I was just saying in terms of acceptance, it's about getting the information first of all. Once they understand their condition, they're able to kind of understand what they're dealing with. We often have this idea of what it means to live with a long-term chronic condition, but the reality is so different from what you've read or what you understand of it. So mainly understanding the facts, mainly understanding the responsibility that is on you now, that can come with acceptance, but also working through that grief. Some people experience real grief around getting this diagnosis. When I say grief, I don't mean losing a loved one. I mean, there could be loss of identity, it could be loss of activity, it could be maybe that feeling of loss of independence, right? It could be a loss of routine that they've gotten used to. And when we talk about acceptance, it's about allowing them to feel what they feel, right? Not undermining their feelings, not dismissing them. It's about really allowing them to feel and process what they need to process, and allowing them a safe space to do that. And that can take some time for people, especially for that anger to go, right? Um, so it's about getting facts, getting a safe space to talk things through, but also understanding that things may be different. You know, it's about adapting, and adapting can be really difficult for people because people don't like change, right? We like to do things in a very particular way, and when we're introduced to change, that can be really difficult to grapple with. So allowing them that space to process everything.
There's some quite heavy emotions coming up there, Pam, of grief, anger, and then, grappling with acceptance. Would you say some of that is resonating for you with yourself and also with your clients?
Not in the case of burnout. In the initial diagnosis, absolutely. When I speak with physicians about the caretaker experience, I always show them the Kubler grief cycle, which is the stages of through grief, as Fatma said, like it's not losing a loved one, but you're mourning the loss of, in the case of your child, if your child gets diagnosed with any chronic condition, you're mourning the loss of what you don't really know is quote unquote normal lifestyle, or what you think that you won't be able to have a normal lifestyle. I do then show a picture of a roller coaster because it's not just a clean cut, smooth thing of grief. You can flow in and out of that from time to time, but not really in the burnout sense. By the time that you get to burnout, you've already accepted it and you are just exhausted by the demands of the condition. Um, and in the grief, it comes from like fear of the unknown because you don't know what that means. But I want to tell you and as the diabetes advocate in me, if you are living with a diabetes diagnosis, you can do absolutely everything. You can do anything. And that's where a lot of the grief and fear and anxiety comes from is that, oh, I'm not going to be able to do this. This is going to change my life. This is going to change my kid's life. How can I manage this? And some physicians, unfortunately, still have advised parents or patients to step back and, oh, don't let your kid do sports or don't let your kid do this. So I would say in the beginning, if you're feeling overwhelmed with grief and challenged, the first thing I say is look for something either you like to do or your child likes to do, whatever that activity is, and Google it, and you will find somebody with diabetes that is excelling at it. So that is your vision of the future. When it comes to the burnout, for the most part, people are already past the grief. There is still a lot of shame and blame because society is continuously blaming and shaming people. And it's hard to always have to educate society about diabetes because people, not with bad intentions, but they'll say things. And some days it might trigger you, some days it might not trigger you. Some days you can choose to advocate, some days you can choose to educate, or you can just smile and walk away is another option as well. So, like I said, it just really depends on where the person is, but the burnout is more this, constant. Now we have continuous glucose monitors. So technology is always with us, like a phone. I can look at my son's blood sugar as long as he's connected all the time, anytime. Constantly looking at that. We don't realize how often we do that. I tend to not, I don't believe I do it as much as some other parents do. When I first got it, I was like, wow, this is amazing. But because my son was diagnosed before that technology was invented, I didn't start with it, but it makes us so dependent on it. So one thing, for just there's small things that you can do. And if a client is facing burnout or someone in our communities burn out, I say, take like a technology break. Still check your blood sugars, but you can do it with a finger prick. Maybe you don't want to wear your glucose monitor 24/7. You still have to take your insulin, or if you have an insulin pump, you're still going to wear your insulin pump, but maybe you want to go a little bit low tech and just take some of the weight off. Or if you have a child that's old enough to take care of themselves and maybe they started doing more and then suddenly you see them flowing back, into I not wanting to do it or they're getting burnout, then, the parent can step in and maybe bear more of the weight again. So it just kind of really ebbs and flows. And for sure, there's days where I get, really upset at diabetes, just, because just when you think like, okay, got it. And then, middle of the night, something happens or during the day or whatever it is, it's always the unexpected. So again, it's just, I don't want to say like case by case, and it does take a lot of acceptance. And as Fatma pointed out, having that safe space where you can just go to somebody who is objective and unbiased and empathetic,
Right.
and you can just tell them, I hate this, I don't want to deal with this. And somebody that will really listen and really
Yeah.
understand it and get you without judgment
Mm.
is priceless in so many ways. It's really, really important to have that.
And I think you touched on something really important there about the feeling of being overwhelmed by the checking, by the monitoring. And often we underestimate the impact that's going to have on you, right? It's a constant state of being alert, right? And you mentioned something about the unpredictability of it all, right? You think you got it and then something happens. And then when that unpredictability happens, it makes you feel kind of like you're on shaky grounds. It makes you feel like you're losing a bit of control there. And that can be really difficult and
Hmm.
overwhelming. And I think even starting with burnout, let's look at burnout as opposed to stress. And I think that those two things get really
Mhm.
confused sometimes. So stress is something that we all experience in our lives, right? You don't have to have a long-term health condition to have stress. And stress can be sometimes a beneficial thing. You know, when we look at athletes, they put their bodies through a particular amount of stress to optimize their performance, right? Or sometimes people say, if I have a deadline and I have that pressure or stress on me, I perform better. I'm able to do what I need to do. However, chronic stress is what we kind of classify as burnout. Chronic stress is when you have that high cortisol in your body for long periods of time, and it's really having an impact on you physiologically, but also psychological. So chronic stress or burnout can cause heart disease. It can cause, cardiovascular disease. It can cause immune systems to slowly shut down. Depression, anxiety, all of these things can happen with burnout. And we say this not to scare anyone or to frighten anyone. We say it so that people are aware of the impact on how burnout can manifest itself. If it is, you have that high cortisol for a long period of time, it can have a detrimental effect to your health, not just psychologically, but also to your physical health as well. So it's important to really look at that and utilize tools that we will kind of touch on later on how to look at burnout, how to resolve burnout. But it's something that I feel like it's really important to have these conversations together so that we can support people not to get to that stage of burnout.
Yeah, I can actually share that I had, and this was like very early days. We didn't have a doctor for 3 years that understood type 1. I was really on my own. There was no community. I'm happy to say so many of these things have changed, and uh, there's an amazing community of parents supporting each other, things like that. But very early on, and this is the result of chronic stress and burnout. I had pneumonia 3 consecutive years in a row because I never
Oh,
slept.
yeah.
And it came on at the same time every year. And by the third year, I walked in the doctor's office and I'm like, pretty sure I have pneumonia again. I know what it felt like after having it.
Mm.
And that's when I started making some changes in my health, which we'll talk about in a little bit. But yes, it affects you. And these are physical symptoms that we know. There's other physical things that stress and burnout does to us that we don't know. And then the whole mental impact of that. And I had, a demanding corporate job at the same time. And
Mm.
it was absolutely, and I know that I'm not the only person that's lived that. I know that there's people probably listening to this call that experience that and much more. And we just keep pushing through,
Yes.
but it's not sustainable for the long term. And so that's why, like you
Mm.
say, it's important to know the signs. So maybe you can get some kind of, intervention. And I don't mean like a medicinal intervention, but
Right.
do something before it gets to that phase.
Absolutely. I think that's really important. And I think you touched on something just now about that sense of being alone, right? And often you feel like you're the only one going through this. It feels like a very lonely, isolated situation. And having this conversation, hopefully we reduce that feeling of being alone and recognize that actually a lot of people experience this and are going through this. And you can get support. There is a community out there that are willing to help and support you.
Yeah, if you have diabetes, and it's one thing like parents of children with type 1 diabetes support each other. If you're
Mhm.
living with type 1 diabetes, find others with type 1. They will have gone through it. You have such a deep connection with others with a shared lived experience, much deeper than even if you're meeting for the first time, like you can look at them and you know the path that they walked. If you're living with type 2 diabetes, also, I encourage you to share with other people living with type 2. No one will understand you better than someone that has walked that path with you. Now, that's not to say that therapy or coaching or any of the other, psychological support is not important, because that is important because they can look at things of the broader picture. But
Mhm.
community is so important in a chronic condition. It's really life changing.
I think on that topic of community being so important, and Pam, you did touch on this a little, more so on the negative effects of it, but there can be a lot of misinformation and a lot of stigma as well, right? So
Absolutely.
that can be quite triggering, and I know that at times that has been triggering for you as well. So how would both of you suggest managing that trigger and managing misinformation when people do see it and what comes up for them?
I think it starts with firstly you educating yourself, right? If you are aware of the condition, if you know what you're living with or someone that you're caring for is living with, I think it starts there. And then when you're noticing or hearing those misinformation or people that are maybe miseducated about it, if you have the capacity, try and maybe educate them on what you know. And I say if you have the capacity, because if you're already at a stage of burnout and you're already so overwhelmed and so tired, it can feel like an added pressure or an added expectation on you. So if you're able to still look after yourself and educate those around you with the facts and what is true, then great. If you're not, you also need to firstly care for yourself. Yeah. And this is where self-care comes in. If you haven't got the capacity, it's not your job to educate everyone. That is not your responsibility. Your responsibility is to care for yourself or the person you're caring for. And that's all.
I love
So
that.
yeah, sorry.
Yeah, I was
No,
just
no, I'm
about
sorry. I didn't mean to interrupt you, but I'm just like, if there were pom-poms and cheer in the Zoom call, like that is so critical. If you have the capacity, I wrote it down and circled it because I love it. I'm going to quote it later. It's so true.
Yeah.
And I don't always have the capacity, and I'm triggered by certain things. And it might depend on how my day's going or how exhausted I am from diabetes or how absurd the thing is that is said.
Mm,
Sometimes there's that too. Now, some people are genuinely curious, and if it's a child, like asking when my son was younger, what's in his pump pack or whatever, no
mm,
issues. Like very matter of fact, I'll explain it because children are quite curious and things like that. But I would be somewhere an adult, waiting in line, didn't meet I didn't know before, for example, making t-shirts for my company or something. And they're like, oh, what do you do? And then I tell them, and then they start telling me about a special diet that's going to cure it. Or I have a list of, like the top 10 craziest things people have said, or that my son's diabetes can be cured with transcendental meditation. That one I did not have the capacity to answer. I just smiled and nodded because I didn't know, some you just don't know what to say. And it doesn't pay to debate things like that. But then there's other times when the misinformation, like it's Diabetes Awareness Month, which is why we're here. And last week, one of the very well-known newspapers published something incorrect saying that there's an increase of childhood cardiac disease and obesity and children eating poorly is what is causing type 1 diabetes. Now, type 1 diabetes is the result of your immune system attacking the beta cells in your pancreas, and they're not sure, scientists are not sure why that happens. Type 2 can usually, in most cases, be managed with lifestyle, but there's a lot of different reasons why someone might get type 2. Sometimes there's genetic issues, or I don't want to say issues, but there's a genetic component. Certain societies are more susceptible to it than others. So I'll leave it at that. But yes, I was triggered, and this was on Instagram, all over social media. I wrote a letter to the editor. I wrote, in response to the post as well under it, and a few people in our community, I said, well, we can all go over and, try to advocate. And some people did, but for some people, it's just too much because some of the comments under it were so frustrating. And especially if your child's newly diagnosed and you know the world that your child's going to go out to, um, you know, saying, oh, eat more chocolate, or it's the diet, or they did this, or the parents, or whatever it is. It's very upsetting sometimes. And those are the ones where yeah, you may not have the capacity, nor should you waste your time on it. And you have to kind of, I don't like the term choose your battles because I'm a fierce advocate for everyone. But there are times where I just kind of throw my hands in the air and go, well, okay, that's, your opinion. And you can't always, like Fatma says, you can't educate everyone. But that's why the work that we do, we're very passionate about it because we are fighting misinformation. There's so much misinformation out there. There's a lot of good information and clinical information and the right information, but also the algorithms in social media where people get their information likes outrage as well. So that's what's pushed to people.
I was
When
just
it
going to
comes,
say about clickbait, right? Rage is a very good way of getting people fired up and getting those comments coming in. So just be mindful of that as well. What is it that you are taking in virtually online? What information are you reading? And check in with yourself. Is that if that's having a mental impact on you and it's draining, and it is draining, then maybe think about stepping back and looking after yourself, right? So just thinking about your own capacity in every step of the way.
It can
sometimes
contribute to your burnout.
Yeah.
sometimes when you're in that mode of, when you are a caretaker or when you're struggling with a chronic illness yourself, it can be quite hard to pay attention to yourself and know what cues are showing that, you are overwhelmed. So what would you say are some of the signs for people to know that actually I'm at capacity and now's not the right time for me to respond?
I think with me, with the work that I do with clients that have long-term health conditions, I've worked with many people that have diabetes as well. It's about firstly having an awareness of yourself, right? What happens to me in terms of my physical body, in terms of my emotional state, my behavior that changes, right? Sometimes we don't notice, we don't say, oh, I'm bad, I feel bad now. We notice the subtle changes in our mood when maybe we're more irritable, maybe we have less patience, maybe we are isolating ourselves a bit more, we are withdrawing from activity, our concentration is short, maybe our appetite is low. So just checking in with yourself and recognizing there are subtle changes happening right now, that my body's trying to tell me something, that I need to stop, take a breather, and start to look after myself. So firstly, recognizing what happens to me when I feel overwhelmed. And then by recognizing those signs, you can kind of catch it early and say, oh, okay, I'm noticing something's happening with me. Let me do something about that.
That's very helpful. Yeah. Uh, Pam, would you say that that resonates for you as well? Was it irritability? What used to come up for you?
Yeah, it can be, I feel certain things, and if it's more like I'm very cautious of how I use this word, but a trauma response, I'll feel it in my heart space. I might shake. There's a few things that I do have, um, I would say, and I've been told by a psychologist this could be a trauma response when I travel. Because when you travel with diabetes and all the devices and all the medication and everything else, and if you have, and in Dubai, we're so blessed that airport security and everyone is amazing and so supportive. But there are some places that I've gone to where airport security has been unnecessarily, I don't want to say assertive, but a little bit more than assertive. The bag dumped out. I mean, and I'm with a toddler that clearly is wearing an insulin pump and things like that. So I know those situations can be triggering for me now, and it's stressful. Like Fatma said, like all of the planning, all of, do taking all the things, it's never easy. So those I know in that anticipation of when it's going to stress me out. If it's someone saying something, those not so much. It just might be now, do I have time? Am I well rested? Just how do I feel in general in that day? I'm more mindful um, of myself, but I know The other thing that triggers me, I mean, I mentioned my son faced a little bit of discrimination, and that was much later in life for him. One thing that is super triggering for me, anytime a child in our community is rejected from a school because they have diabetes, that is not okay. So it's a matter of then supporting the mom, getting her the information she needs, sending her different laws and articles that have quoted people that say this should not be happening. Schools still do it. But I've been dealing with diabetes for 15 years now, so I kind of know where my trigger points are. But it's often in the beginning, in hindsight, it would be more of a feeling. But having said that, at the same time, when everything is overwhelming, it's very hard to know what's a trigger and what's just the daily overwhelm, for lack of a better word.
Mm. It's
And
got a lot to do with awareness, clearly. It's that awareness of your own physiology, your own feelings, your own sensations, and what's going on for you there. When would you say, Fatma, is the point of seeking support, the point of seeking help?
okay, so that's a really good question. I think when things feel too overwhelming, when you've come to the end and you're completely deflated, depleted of all your resources, when you're noticing behavioral changes, for example, you're sleeping a lot more, you're sleeping less, you're eating more. When you're noticing that you're not able to concentrate, you're not able to kind of function on a day-to-day basis, and everything feels like you're climbing a mountain, right? The simplest chores just feel so overwhelming. And that is when I would say, okay, we need to kind of work on this. Something needs to happen. We need to bring in tools. We need to kind of seek support from maybe doctors or psychologists or coaches, whatever support you need. I think that is kind of key, when things feel too much to carry on your
Yeah.
own.
I would like to add to that. And I would say also from the beginning, actually, I was extremely shocked, overwhelmed. I had a toddler and I knew about type 1 diabetes, but I didn't really know. Did everything right, was, making my own baby food and do, all the things. So the diagnosis was quite shocking. And and it was beyond overwhelming. I didn't know where to put it. And I would say, if it's accessible for you and you can, and this is why mint tea is great, like get support from the beginning. It will
Mm,
help. And I actually did go see someone in the beginning because I was just overwhelmed. Like I was lost, but I knew I had to keep going because I had to care for my child.
right.
And that was the first and only person that ever said, it is okay to be upset. Because in the beginning, we're all like, well, at least it's not, something worse. We say that a lot. But she's like, wait a minute, but this is happening to you.
Mhm.
So you are allowed to be upset and be angry. And then it goes back to the grief cycle, right? And the first thing is, you're upset, you're angry, you're grieving, all of that. And I think that is the perfect time to, like, there's no better time than the present to seek professional support so
Yeah.
that then when you do reach the point where you're extremely overwhelmed, then you do have someone to reach out to, or you may already have some strategies that they've given you that you can tap into.
Yeah. I often talk about self-care versus aftercare. So aftercare is where you are completely deflated, right? You're not able to function, you're too overwhelmed by life and everything around you. And when you practice aftercare, kind of utilizing the tools and techniques, it can be really difficult. It can take much longer to get you out of that. However, if you practice self-care, practice those small meditation or breathing or, things that make you feel good, that is mentally good for you. If you practice that, it will stop that burnout from happening, right? You're kind of stopping it on its track. So this is why I always preach early warning signs. Recognize them because your body is always trying to tell you something. Be in tune with your body, listen to it and say, how am I feeling today? How would I rate myself today out of 10 in terms of my anxiety, my worries? And then look after yourself. So you don't have to practice aftercare. You don't have to get to that stage.
Yeah. And
If
it's,
you're
oh, I'm so
well,
sorry.
that's
I
all right.
just want to say, I think it's important to add, if you're living with diabetes, your blood sugar will tell you.
Yeah.
If your blood sugar is continuously high and you know your insulin is good, you
Mm.
know your insulin pump sites are working and you've done all the things, you've consulted with your doctor, and stress is super triggering for blood sugar. Stress will lead to high blood sugars. So this could be a sign. You know, if you are practicing self-care, you're exercising, you're eating well, it doesn't matter what type of diabetes you have. If you eat well, you will have better outcomes. So, you know, I'm not saying all of these things need to be perfect all the time, but I can tell from even my son's glucose monitor graph when he's taking an exam, it goes
Mm.
up. And that's not like the overwhelm stress. That's normal daily stress. But if you're really stressed out and really burnt out, it's going to affect your blood sugar. So that's another indicator to look at.
Yeah, I think that's really, really helpful. Thank you both. One thing that's coming up is when we get when people should seek help, right? From the get-go, from the beginning, because that's how you're going to prevent getting to that point of extreme burnout. And then if you are already at that point of burnout, then you know that you've reached your capacity and you do need support. Sometimes it can be quite confusing what support to reach out for. There's coaches, there's psychiatrists, there's psychologists, there's doctors. So when it comes to holistic care, when it comes to, having all of both your mental health and your physical health needs taken care of, what should people look for?
Um, Firstly, I always advise people to be mindful of their self-talk. What are you telling yourself, right? When you are, living with this chronic long-term condition, sometimes you may speak very negatively of yourself or your abilities or your performance, whatever it may be. That can have a huge impact on your stress levels. If you're really hard on yourself, if you have really kind of high unmanageable expectations, that can maintain that stress and keep it going and, lead to burnout. So be mindful of self-talk. Show yourself compassion. Always ask yourself, if a friend was to say this to me about themselves, what would I say back to them, right? Because we're always better at being kinder to others than we are to ourselves. Number two, think about what is it that works for you? What makes you feel calm? What makes you feel balanced in your life? What makes me feel calm may be very different to you. For others, it could be meditation, it could be massages, it could be breathing techniques, it could be socializing, going out with people. And that can also in line reduce the isolation that people may feel as well. I would always advise people to communicate with your loved ones, communicate with the people closest to you. Because again, we're trying to reduce the stigma that people experience when they are, sorry, Ilham, hello, thank you. So reach out to your community, to your village, speak out about it. The more we speak, the more we reduce the stigma or the taboo side of things. So, and also by speaking, you're able to lift that load off your shoulders. You're able to get that support that you need. Additionally, think about the behaviors that you're doing or not doing, right? Sometimes when we're in burnout, we can neglect ourselves. So we may isolate, we may not be doing our usual activities, we may be reducing our hobbies. So think about the behavioral side of things. What are you doing and what are you not doing? Are you sleeping too much? Are you eating too little or too much? All that kind of thing. And obviously do the opposite of that, because we know that can help reduce that burnout and that stress that you feel. And also take a break. It's okay to take a breather. If you're managing this long-term health condition, and on top of that, you've got work. On top of that, you've got family responsibility. You've got financial things on your mind. It's a lot to carry. Maybe it may mean taking a break from work for a few days, right? Taking some holiday, maybe delegating some responsibilities that you might be experiencing. So just really thinking about what changes can you make to reduce some of the pressure that you might be feeling as well.
Thank you so much. Those are really, really helpful, very direct tips and strategies of what people can do, Fatma. Thank you so much. Pam, as a coach yourself, do you want to give a little bit of insight into the difference between therapy and coaching? And I'm just going to also just put in here that we are opening up for questions. So if any of you do have questions, please just pop them into the chat, and we'll address them for you.
Yeah, sure. Yeah, please ask any questions. So when it comes to coaching versus psychological therapy, and also versus when you're seeing your doctor, there's sometimes I think there can be a lot of confusion, and a lot of that has to do with what we're seeing on the internet, as we mentioned, misinformation. There's people out there that are not doctors that are giving medical information. So when should you be seeing one or the other? You should always be following up with your doctor. If you have diabetes, preferably quarterly, if you can. If you've had diabetes for a longer time, maybe it's 3 times a year instead of 4 times a year, but that's really up to what you and your medical team decide. When to seek psychological therapy, if you're really feeling any of the things we talked about today, overwhelmed, too much stress, burnout, like you don't want to deal with diabetes anymore and you're done, and that will directly impact your health, then that might be the perfect time to reach out to a psychologist, social worker, or other therapist. Therapists tend to, is what we call in the coaching world, they are experts. They will give you advice. They will give you tools to help manage everything. They work to achieve understanding and emotional healing, and they work with you to get to the root causes of your problems. Now, sometimes if you are extremely overwhelmed, you may need to see a psychiatrist, and psychiatrists are the ones that would prescribe you, medication, support if needed. Hopefully it wouldn't come to that, but in the event that you needed it, that is who you would seek support from. And if you do take any other kind of medications, make sure that you follow up with your endocrinologist, because those can also affect your blood sugar. So it's really a holistic approach. Coaches, we focus more on the future. We do not deal with people that are experiencing burnout, although because I'm in the diabetes space, people do share with me their burnout, and we talk about it. And of course, I'm always, a good coach will refer you to a psychologist when you need one. We are not trained as a psychologist is. We are trained in positive psychology, and our focus is mainly on goal setting. So we will support you usually when you're more in the what I call more of the positive space, when you're not in burnout and you're not in overwhelm. We work with you to set goals to move forward. And maybe you've just come out of burnout, but you want kind of a fresh start. We'll work with what your doctor has prescribed to you to hold you accountable, to break things down into achievable steps. But we are driven by supporting you in your goals and what you want to do and what brings you joy, and taking action to achieve that. So those are kind of the main differences in who to reach out to, and what to do. But they all are supportive along the journey, and you may need them at any given time.
That makes a lot of sense. Thank you. If there are any other questions from anybody in the audience, maybe if you want to, unmute yourself and ask yourselves, then that's okay as well.
No questions?
No questions, surprisingly. There's usually so many questions. But I have another question. I'm thinking from a perspective of prevention, right? Preventing yourself from getting to the stage of burnout. And I know we talked about awareness, but can you think of any specific strategies that someone might be able to use, particularly if they're, if they are already quite busy, and they haven't got that safe space to sit down and get aware, or they haven't already built that awareness. Are there any grounding strategies or techniques that they can use?
I would highly suggest that everyone, all of us, chronic condition or not, really we need to focus on all of those components of lifestyle medicine, which is eating well, moving. People that manage children with diabetes don't really sleep, so I don't want to say sleep well, but sleep hygiene, sleeping well is so important. It affects everything. Drinking enough water, spending time in nature, community, as Fatma mentioned, relationships, those are so important. Those things we can't find the time to do everything, all of those every day, but we need to do them most of the time. Like just before this call, even though I was really tired, had a lot of meetings, been on the go for quite some time, um, I just broke, stopped, took my dog for a walk. So I spent some time outside. I moved, kind of got away from my desk and things like that. So it's the small things. They don't have to be big things. I would say focus on those things that are going to lead you down the path of a healthy lifestyle. And then when you do face overwhelm and burnout, it doesn't necessarily make it easier, but you will be in a better space physically and mentally to manage it.
I agree.
Thank you. One of the questions we've got is on financial burden. So obviously diabetes has a heavy financial burden, and I think that would be even more pronounced in the UAE where, certain things might be covered by people's insurances and sometimes it might just not be. And so how can people manage that stress? How can they manage the stress of financial burdens?
That's a really good question.
Yeah, and it's so relevant to the area that we live in, right? In terms of insurance and how expensive things can be. I think that there are some organizations or hospitals that you can maybe speak to them and see if they could make a payment plan, if there is a way that you can pay in installments or in small bits at a time to reduce that pressure that you might be feeling. I would also maybe think about the community around you. Is there any way that you can rally the community around you to give you some ideas on terms of budgeting, looking at your financial outgoings? Is there any reductions that you can do just to kind of keep afloat? But it is a very, very big thing that people report having, which is financial stress. Yeah.
I would also say that yes, there are a few organizations that can support, especially if you're in the UAE, for example, Jalila Foundation, they have some programs that can support. The other thing, if you do have insurance, one of the most common questions I get asked is, what is the best insurance? There is no best insurance. It just depends on your plan. Read, and it's hard, but try to understand your insurance plan. If you work in a company and it's through your company, talk to your HR to ask them to help you and also to help advocate for you. Because sometimes things may not be covered or they may be covered and the insurance isn't approving it or whatever. There's always, so many stories around this. So get support to understand what's available to you. And also, please know that if you have diabetes, before all of the latest glucose monitors, the insulin pumps and technology that are on the market, people have been living well with diabetes for a very long time. There's several people I follow that are in their 80s that have had diabetes since they were children, type 1. And if you think of all they had back then were very large needles and the way insulin wasn't even as good as it is now. And they've lived with minimal complications. So maybe you can't always afford to get the CGM, get it from time to time to check in and see how things are going. But you can still manage diabetes well on a lower budget. You don't have to have the latest and greatest things all the time because they can be quite expensive. And that's not to minimize the stress of the financial burden because it is. But start with what you can, what you need. You need insulin, you need medication. Make sure you're visiting your doctor regularly. All of the additional extra things, add them as you can or from time to time when you need them and find out what works for you. And of course, if anyone has any questions about that, I can, answer that more deeply offline.
Thank you so much. I think something that is coming up uh, quite a bit in the comment section is regarding family members and close relatives. So sometimes family members and close relatives can be misinformed or they can cause stress that could lead to burnout. And even if you're trying to protect your own child from that, it's much more harder when the comments aren't from public, but are from people that you consider loved ones. So how can boundaries be put in place to avoid this?
I think this is where a level of assertiveness can come in, right? It can be really difficult to be assertive, especially to the people that are closest to us. However, it's important to advocate for yourself and your child or whoever you're caring for that has diabetes. And we know that misinformation is very common. Sometimes it could be well-meaning and they don't think there's any harm in what they're saying. And they don't understand until you tell them, until you let them know that this is quite harmful for me. This is quite upsetting, right? So it's all about communication, communicating your needs, communicating that in a very assertive way and advocating for yourself. Now, what they take and what they use with that information is something that we can't control and is not within our control. But it's not your responsibility to police their reaction, right? It's your responsibility to communicate your needs. And what they choose to do with that is entirely up to them. But at least you've advocated for yourself and you created those boundaries.
It's
Yeah, I think
really difficult.
advocacy is really important, but it's still the toughest thing. It's very, very
It's
tough.
hard, especially with family, because they'll forget that they've asked you a million times, hey, can you eat that? And there's a meme that goes around the internet and it says people with diabetes can eat anything but cookies laced with poison.
Mm.
Because yes, there is a lifestyle component to it. You can get better outcomes if you're eating well, but we all should be eating well. Where this whole kind of cutoff that people with diabetes should eat healthy and people without diabetes can continue to eat ultra processed junk food, I don't know where it came from. Nobody should be eating badly. And it affects our mental health as well, right? It's proven time and time again. So if you have a family member, they're asking, can you eat that? And again, it's that question of, do you have the capacity to really go deep and educate or just say, yeah, they can eat that. I can eat that. It is part of an overall balanced diet because it's not just that one particular, dish or snapshot in time. What you are eating is part of an overall eating plan. If you have type 2 diabetes and even type 1, you should have seen a certified dietitian that's part of the clinical team that will teach you how to count carbohydrates. You should be eating more of like what we call in lifestyle medicine the healthy plate, where half the plate is vegetables most of the time. Now, we know that's not like a perfect thing that we all do every day. And especially in this day and age, the way food is sold to us, it is very difficult, but we should be eating healthy most of the time. And so it's very hard when relatives insist that you're doing something wrong, or they might even, be ashamed of the diabetes in certain cultures. I've seen this happen as well. It's really difficult. And again, case by case, check in with where you are and take a deep breath. And when it's family, it seems to hurt more. And like you said, Zuleika, sometimes they have the best intention, but it can make you feel even worse. So advocate and
Yeah,
educate as much as you feel on that particular day.
exactly. I agree with that. I think advocate for yourself and then at the same time be able to balance your own values against your family's. If you are struggling, I mean, we can just within speakers today, I don't have a value of chronic health illness, right? I don't understand it fully, right? I have to be able to own that. And if your family's members aren't able to own that and they are coming from a place of judgment, then it's on you to be able to say, I do have that knowledge. I do know. And I
Mhm.
do have that value because I live with it day in, day out. And you don't necessarily have to say that as well. It can just be internal. And
Mhm.
once that internal battle is overrun, that this is my value, so I already understand it, and it's not their value, so they don't understand it,
Yeah.
then it becomes a lot easier to be able to navigate.
And I
Yeah. And
think
I
what
find, oh, I'm so sorry.
understanding, sorry, and when we talk about understanding, we also need to think about the generational gap, right? They might be coming from an entirely different generation
Mm.
where there wasn't that access to the internet or information or data that we have right now, right? And they're coming from what they've heard or things that they've grown up to know. So it is coming from lack of information. It is coming from that generational gap that we're experiencing, and just giving them that information, giving them that knowledge, and hoping that they respect it, respect your boundary, and respect that information that you've given them.
Yeah. So, and that's a really good point. And it really comes from a place of love. I ran into a lovely older man in the pharmacy once, and I was buying insulin for my son. He proceeded to tell me, "Oh, make sure that he's eating or maybe drinking water, okra or ladyfinger, as they call it." And I know he had the best intentions, and he was so sweet. And I just said, "Thank you so much." So sometimes you can just do that, and then because in the case of family, like if you're eating, holidays are coming up, and a lot of questions, and sometimes less is more, because if you say more, then maybe they'll have more responses. You just say thank you so much.
Yeah. Yeah. I'd like to thank both of you. Thank you so much on behalf of the community, and just thank you from on behalf of everyone who attended today as well. It was really, really helpful to know your insights from two very different perspectives as well. But you came together very well, and we can see that you do both deeply care about people with diabetes. And I just also want to open up that space, that safe space of support. There are safe spaces out here. There are communities here. There are people here to support you. There are professionals here to support you, to listen to you, to give you a space to explore, who you are and how this diagnosis, whether it's for yourself or for someone that you care for, has changed you. And in terms of Mincy itself, we are a mental health platform. Fatma is one of our therapists. And, we're here to support you. We're here to make therapy accessible, affordable. We're here to make it so you can have your mental health needs and your general well-being needs met in one place. And we're very excited to welcome you. If you're not already on the app, if you aren't, please do download the app. Please have a look at, some of the resources we have. We've got a lot on chronic illness as well. We have specific support for diabetes, including tools and articles on this specific topic of diabetes burnout, but also, managing chronic conditions generally, what kind of how it shapes your identity, how to cope with the mental health challenges that come along with chronic illness as well. But thank you so much for joining, and thank you to our speakers as well for being here. Thank you, Pam. Thank you, Fatma.
Thank
Thank
you. It was a
you.
pleasure. Thanks,
Yeah,
everyone.
likewise. Take care. Bye.
Bye.